Choose country. Discover the rural practice pathway to a health career in WA.
I've been up here in Broome for the last 12 months, completing my third year of medical school alongside with the fifth year UWA students. Got involved in the program through the Rural Clinical School. I was one of the lucky ones that was selected to come up and live and work up here for the year. I've enjoyed many things about living in Broome. Firstly, there's been the varied clinical experience. Broome is a very interesting place and the medicine is quite fascinating. We service the entire East and West Kimberley. We're the largest hospital in the region, and so we've had patients from remote communities who come in very unwell, and we get the opportunity to learn about their problems and their medical issues and then patch them up and sometimes send them back down to Perth, and other times we can deal with them in our hospital itself. There are so many advantages about being a student in a rural area. In the city, you're one student in a room filled with consultants, registrars, interns and other students. In Broome Hospital, you are one student with one GP and you are there getting hands-on experience of being a doctor. I used to think that going to the country and working as a doctor would just mean working full-time, just being flogged like a horse and doing boring medicine every day, all day. But actually the medicine is interesting in Broome. The patients are interesting, their stories are interesting. We see them in the hospital and then we get the opportunity to go out on a Royal Flying Doctors trip to their community and experience firsthand what it's like to live and work in a remote community in the Kimberley. One of the things we did this year is our university sent us up to El Questro for an emergency medicine course. Every morning we got up and we walked a gorge, and every afternoon we'd go through medical scenarios. Who else gets to learn in an environment like that? No one here in the city. They go to lectures and they go to the hospital. We go to the hospital and we finish our day down Cable Beach, or we finish our day sitting under a tree talking to somebody and learning about their history and their culture. I sat there and thought, this is a day of practicing medicine. Whilst my students are still lining up waiting for that surgery in the tertiary centre, I'm here and I'm enjoying life and I've had a really interesting day.
Choose country. Discover the rural practice pathway to a health career in WA.